My name is Dr. Waheed Abbasi. I'm a GP and I'm Clinical Director of Mental Health and Learning Disabilities for NHS Stoke-on-Trent Clinical Commissioning Group. Today I'm delighted to present to you our new Learning Disabilities Strategy for the city of Stoke-on-Trent. This exciting new strategy is called Living My Best Life, a life course strategy for people with a learning disability in Stoke-on-Trent. This strategy has been jointly produced by City of Stoke-on-Trent and NHS Clinical Commissioning Group, working with people who have lived experience of living with learning disabilities. This strategy is based on Stoke-on-Trent Health and Wellbeing Plan principles, and those principles are start well, live well, age well, and a healthy city. The strategy will form the foundations on which we will build our future learning disability services over the next 5 years. This strategy aims to make sure that children, young people, adults, and older people with learning disabilities have equal opportunities and rights as to those who do not have a learning disability. We know that people with learning disabilities have poor health outcomes and often die prematurely at a much younger age, and likely through a preventable cause as compared to people who do not have learning disabilities. Learning Disabilities Mortality Reviews, or LEADER program as we know it, has highlighted these stark inequalities and realities in our system. We also know that people with learning disabilities often have poor physical and mental health. Through this strategy, we will continue to make efforts to improve and promote physical and mental health of people with learning disabilities through our annual health check program. We also know that people with learning disabilities face difficulties in accessing mainstream health services. We will make sure that our providers, both primary care and secondary care, make those reasonable adjustments to make sure that people with learning disabilities have access to high quality health care as would anyone else without a learning disability. Our learning disability strategy aims to address these very health inequalities which I have just highlighted. As a co-producer of this strategy, NHS Stoke-on-Trent is fully committed to deliver the objectives of this strategy. NHS Stoke-on-Trent will make sure that every possible effort is made to make sure that people with learning disabilities in Stoke-on-Trent have access to high quality and safe healthcare which they deserve. Working together, let us make sure that we provide every possible opportunity to people with learning disabilities so that they can achieve their aspirations and fulfill their lives as a part of our communities. Thank you so much.